Hi, I'm Saurabh Kochhar, founder and CEO of Meddo-Health. Outpatient care is always your first step towards healthcare, right? And unfortunately, I think in India that's the bit which is most ignored. And there is a proverb saying a stitch in time saves nine. And I think that's something that we've gotten completely wrong when it comes to health. We delay our health till the point हमारे को extensive measures ना चाहिए, right? So just to give you an example, almost 70% of cancer cases in India are detected in their last terminal stage, which is more than double that of where developed countries are. And the biggest reason is we keep ignoring the small signals unless they become too big to even treat sometimes, right? And I think that while is a output problem of where outpatient care is, I think structurally it's extremely fragmented. 90% of clinical establishments in India are actually single doctor establishments, which means left right doesn't know what the right hand is doing. There is no traceability, there's no accountability of care. And lastly, I think nobody has focus on patient per se, right? It's a very, what I call a hatti mindset, right? A doctor is qualified to give prescriptions, and that's all their focus is, that, give me a table and chair, I'll open a clinic and I'll start writing prescriptions. A pharmacist is opening a chemist shop. Similarly, a radiologist has a radiology center, pathology center, and so on and so forth. Nobody is turning the lens around onto the focus and turning the focus on the patient, who's the ultimate consumer of this service. They're not consuming a consultation. They're not consuming purely medicine. They have to consume care. And I think that is completely missing. Again, I think the same issue, right? India, while overall insurance penetration is now increasing almost 50%, actually above 50% in many states, that in outpatient care is less than 1%, right? So the entire system today is well oiled to push people into hospitals rather than keeping them out of it, right? So hospital earns more, doctor earns more, patient actually has incentive to be in the hospital rather than, because they'll get it covered by insurance, otherwise not, right? So I think with all of these things, it's very, very important that even from an insurance or even a payer perspective, we kind of bring back the focus to outpatient care and treat ailments well in time and with far more rigor than wait for that to get to a point where it needs hospitalization. So I think outpatient insurance globally has been one of the biggest focus points, but in India, again, that's been a missing piece. So with Meddo, what we're trying to do is basically organize the entire outpatient care space. Like I said, realizing that bulk of transactions, if you think about the overall healthcare industry, 99% of the times you do not need hospitalization. But in India, we're actually having more than double the hospitalizations that we need. And if we need to bring them down, we need to be able to provide trusted quality care at the outpatient care level, right? And given the fragmentation, given the lack of technology that is involved in overall provision, that's not being able to get done. So what we are doing is we're actually working with these individual clinics, the neighborhood clinics, and trying to upgrade them into full service health centers so that from a patient's perspective, you can close your eyes and walk into a Meddo center and rest assured that you will get a high quality of care conveniently near your doorstep. You don't have to run through 10 different hoops to get back on your feet. Whatever you need to get back on your feet, any service that you need will be provided from the same center and will be fully taken care of and handheld throughout the entire care process. So that's the first thing that we're trying to solve. And like I said, the way we are doing it is by partnering with these individual doctor clinics and upgrading them to be full service centers from service delivery perspective, from technology perspective. Again, think about it. If you have to do telemedicine today, आप जाएंगे किसी website पे and it will be a completely different set of doctors than what you would go to if you're walking into a clinic. We're saying that cannot be, right? So whether it's doctors, whether it's diagnostics, whether it's medicines, whether it's nutrition, whatever you need cannot vary in quality by the channel that you choose. It's same doctors that are going to be available to you whether you walk into a clinic or you want to take a consultation from the comfort of your home, right? So it's about bringing quality, bringing trust back into healthcare, which somewhere I think we've started to lose And the first question in your mind when you visit a doctor or when you're going through a health journey is कि यार मुझे कोई पागल तो नहीं बना रहा, कोई मेरे से पैसे तो नहीं काट रहा है, and so on and so forth. He's saying we'll take care of all of that so that you as a patient, you take rest while we take care of the rest. Well, we started in 2018, started to build on the problem, build on the product in 2018, and we started operationalizing clinics only in, I think, early 2019. And then, of course, we had 2 years of COVID in between. But I think what gives me a lot of confidence, a lot of push, is the fact that in those short year and a half, 2 years that we have got to execute, we have more than 300 centers. We are already the single largest clinic chain in the country, and growing at a significantly good rate, month on month, year on year. So till now we've already serviced more than 1 crore patients through all our centers and through our technology, and continue to add another 5 to 6 lakh patients and prescriptions to the kitty every month. So yeah, I think we've made some decent progress, but I think it's still very early days. We're still scratching the surface. India has 5 lakh clinics, and if nothing else, we should have at least 10% of those on the platform. Well, I think if you think about, again, the space that we're trying to solve, outpatient care, there's 2 parts to the technology. One is the core prescription tech, and then there is the fulfillment tech. So what we had built was the fulfillment tech, and with the acquisition of Meddo-doxper, what we've kind of gotten access to is, I think, one of the finest and most stable, scalable prescription technology that exists in the country today, right? And again, it's no luck or chance that using that technology, using our tech stack now, we are the single largest data platform in the country as well, right? So we have more than 2 crore prescriptions in the bank. We have some of the largest hospitals in the country running on our technology, whether it's Manipal, whether it's BLK, whether it's Nanavati, just to name a few, Wockhardt, right? So all of these hospitals use our technology to kind of feed their outpatient care patients. So I think bringing together technology along with service is the only way we believe that this entire problem can be solved at scale. So I think we're just around the corner where India has to move towards real world evidence, to evidence-based practice, all the buzzwords that we keep talking about, but the underlying important bit for operationalizing this is always having access to deep data, right? Longitudinal patient data, which is something through both Meddo-doxper and Meddo. Together, we are now trying to do more and more of. So we are live in 4 cities with the full suite, like I said, the service center model that we do. And we have more than 4,000 doctors on the platform using our technology across almost about top 80 odd cities in the country. So I think the plan would be now to bring more and more clinics, more and more doctors to partner with us in the full service Meddo model, and enabling, I would say, interventions at scale, whether it's in terms of OPD insurance, whether it's in terms of payer-driven programs, or it is, I would say, real-world evidence and evidence-based practice that we keep talking about. The idea is to digitize more and more prescriptions, create more data, and serve more patients. And I think by the end of the next year, we should have at least 2,000 clinics that we would be running under the Meddo brand, and hopefully over the next 5 years, at least 10 to 20,000 of them.